Hi, I'm Dr. Eskander. I'm a family physician. I practice in Cookeville, Tennessee. I'm the medical director of CareAll, and I'm board certified in family practice as well as preventive medicine. And today, I'd like to discuss with you the issue of heart disease and emphasize prevention. Heart disease is still #1 leading cause of death. It kills more Americans than any other disease, followed by cancer. Cardiovascular disease is very prominent in Western society, including ours. There's so many risk factors for heart disease that I'd like to share with you today, and the key for prevention of heart disease is early detection and intervention with the risk factors. The major risk factor for heart disease is high cholesterol, high sugar, high blood pressure, family history of heart disease, as well as sedentary life and overweight generally. If we can intervene early to control these risk factors, that's modifiable. I mean by that something we can control through medication such as high blood pressure, high cholesterol, diabetes, as well as controlling our weight. That will be a major, tremendous progress in controlling heart disease. In the last 20 years, we have been successful to reduce a lot of unnecessary deaths from heart disease. I myself is a victim of a heart disease. I had a heart attack when I was 41, and I had little children that I have to change and do something. I don't have a high blood pressure, I don't have a high cholesterol, I have diabetes, but my eating habits was not right. I also have, unfortunate, high risk for heart disease from genetic part. So that's not the part that we can do anything about it. We can choose our genes. That's a non-modifiable risk factor such as age. If you are male, if you're above 50, you have a high risk of heart disease from your family. There is not much you can do to modify these risk factors. But the risk factors that we can work, if you can go to your doctor, have a physical, check your sugar, check your cholesterol, check your blood pressure, make sure you're physically active, as well as you control your weight. I think that's all we can do to reduce our chance of heart disease. We don't choose our sex, we don't choose our family, we don't choose our age, so this is non-modifiable risk factor. Other than the risk factors that we all know and well documented and studied in Birmingham studies as well as other huge study, heart disease can also be associated with some other risk factors that we don't work hard on it yet. Such risk factors include elevated uric acid. People with gout are more likely to develop heart disease than patients with no gout. Also elevated white blood cell counts. There is some new study that proves that elevation of white blood cell counts might be an independent risk factor for heart disease. Personality disorder is very important. If you have hostility, every time you stop in the traffic light, you feel like people get in your nerve, people has to move, that's not good for heart disease. That's another risk factor for heart disease. Last but not least, there's some infection that's in the gum that might be associated with heart disease, and Vanderbilt in Nashville, Tennessee is one of the leading colleges to conduct this research, and they found maybe some association of some gum disease with heart disease. Thank you for listening. Have a good day.